Just what is cultural competency? Basically, it means being able to provide effective and respectful health care to people of different cultures. A culture refers to the shared beliefs, values, traditions, and ways of life of a group of people. These groups can be made up of individuals who share the same race, ethnicity, religion, or even a trait, such as age, income level, or where they live. Therefore, a culture can be a group, such as teens, the elderly, the poor, people who live in rural areas, city dwellers, or the homeless. When it comes to cultural competency, we have to be careful not to stereotype people. For example, just because a person is Muslim doesn't mean she will think or act like every other Muslim. There is a great deal of difference within the Muslim culture. And just because people are from one geographic area of the world doesn't mean they will think and act alike either. For instance, there are more than a dozen countries in the Caribbean region, each with their own cultural identity. So remember, each person is an individual, regardless of where they are from. Becoming culturally competent is not about learning a lot of facts about many different cultures, and it's more than just overcoming a language barrier. Being culturally competent is about being respectful, open-minded, and willing to learn as you go. Understanding how to tailor your interactions to each patient will take a little effort. But look at it this way. The effort you put in now is likely to save you or others even more effort down the road. Why? When you make sure patients receive high-quality, culturally sensitive care from the start, you will help prevent patients from coming back sicker at a later time. When people get a lower quality of care than they should, their health can worsen over time. When they return to the healthcare facility, their condition can require more attention and effort to manage. There's another benefit of being open-minded and willing to learn about other cultures that you can experience right away. Being sensitive to other cultures will help make the interactions with your patients go more smoothly, and you will find that you have fewer problem patients. Let's look at an example. This South African woman is in the ER because she's having jaw and arm pain. She has no insurance and explains that she takes a drug for high blood pressure when she can afford it. The nurse remembers that the patient was in the ER a few weeks ago and that her EKG showed non-specific changes and she had a normal chest X-ray. The staff treats the woman with little empathy because of her multiple visits to the ER. The woman senses their indifference and gets angry, which makes the staff label her as a difficult patient. During her long wait, the woman gets angrier and starts being rude to the staff, who can't wait until she leaves. The doctor finally decides to do a cardiac workup, and the cardiac enzyme test shows that she is having a heart attack. She is sent for a coronary angioplasty. How would you feel if you were this woman? Chances are, if she had been treated with respect and empathy from the beginning, she wouldn't have become angry and rude. She also probably would have been triaged as a higher priority, and the doctor would have known sooner that she was having a heart attack, which is no small matter.